Welcome everybody. PEBB's 2021 Open Enrollment Seminar here. Open enrollment. Okay, this is one just for employer groups. Again, this open enrollment here starts next month, November 1st. We have webinars. Of course, we're cleaning one today. We had one on October 5th for state agencies. We had one on October 12th for higher education. And today's is for employer groups. On the agenda today, we'll talk about general open enrollment information, medical plan changes, premiums, dental, life, AD&D, and long-term disability. For those who key into Pay 1 changes. We'll have a break at that point there. Then we'll talk about 2021 rule changes, worksheet updates, and reminders. Open enrollment information. All right, begins November 1st to November 30th. We all know that. It's been as previous years the same way. Again, there's going to be a 2021 form. Please don't use 2020 form because they're not out yet. Please use 2021 forms. And the signature date must not be prior to November 1st. Change is going to take effect on January 1st, 2020. And a reminder this year, there is no in-person benefit fairs this year. I do apologize that, but with the COVID thing going on, there is no in-person benefit fairs this year. But we are going to offer online virtual benefits fairs 24 hours a day, 7 days a week. What can you expect to provide there? We'll have benefit options and plan availability, plan comparisons. We'll have videos out there for you and webinars. More information about that, we got an open enrollment webpage for more information, and you see the link there. Again, in-person benefit fairs will not take place this year due to COVID-19. We hosted a Facebook Live event there to learn about changes, get answers, and more. That was on October 14th at 4 p.m. Jamie said there's a recording out there, right, Jamie? A recording out there that if you did miss it, is available for you to take a look out there for you.
That's right, and there's two different parts to it as well, so it looks like they got cut off. So there's part 1 and part 2 recording available.
And maybe you can see what people had questions about, whether plan changes or something else. So again, on your leisure, please take time to take a look at it if you want to do that. As far as employee communications, again, this is really the only notice we're going to send to employees about open enrollment. We mail a newsletter out there for you. Again, also email if you sign up for the email notifications. In that newsletter, also information about credible prescription drug coverage. And summary benefits and coverage notice will also included in the newsletter. Again, this is the only notice we send for employees about open enrollment. So we kind of rely on you to actually help us notify employees open enrollment is coming. All right, now who signed up for Gov Delivery? You don't know what that is? And Gov Delivery, sign up through the PERS Pay website. You have to sign up for that though, because if you do that, you're going to email messages that we create at Healthcare Authority, usually about 8 to 10 of them through open enrollment that forward on to your employees. Basically, we will send it to you, already done. You take the emails, you forward it right on to your employees. Again, information about open enrollment will be in those emails. Again, in order to get those emails though, you have to register for Gov Delivery on the PERS Pay website. Hand side under Toolbox, you'll see signing up for outreach and training messages. And you complete the information, and now you're ready to go for the Gov Delivery newsletters or updates. So what can an employee do during open enrollment? They can change their medical and or dental plans. They can enroll in PEBB medical coverage without proof of loss. they previously waived before. And if they want to waive medical, they have to be able to enroll in TRICARE, Medicare, or other employer-based group medical. Coverage on the health benefit exchange is not considered employer-based coverage, so they can't do that. All right, so again, we're talking about open enrollment and what employees can or can't do. Again, we talked about adding eligible dependents without proof of loss. They can do that during open enrollment, but dependent verification is required before the end of November. So if I want to enroll in dependents in coverage, and they have previously not been verified before, they have to return in the dependent verification before the end of November. For a valid list of DV documents, they're available on the PERS Pay website. You can also remove dependents from medical and or dental plans. You can also change the tax status of a dependent during open enrollment. How can changes be made? Again, you have the forms on the left. You can do this online too, certain things. When you're adding a dependent to medical or dental, you're going to need that enrollment form. Remember, online, you can't submit dependent verification, so you need an enrollment form. You could change the medical and or dental plans. You can remove a dependent from medical or dental. You can waive enrollment in medical. You can enroll in medical previously waived, using both ways of doing that. You can attest to the surcharge, either using the forms or online. In order to change a tax status of dependent, you got to use that declaration tax status form in order to do that. We're going to have some changes to the enrollment form, and that's going to be available on November 1st. This information was noted in the September for-year benefits newsletter. One of the changes is going to be an optional gender identity field, male, female, or X. The sex field will remain as sex assigned at birth. And one big change, which was located on the bottom of the first page, the employer section, will be moved to page 10. Again, that information was in the bottom of the page 1. The form will also be available online in fillable PDF format. It will be on the Forms of Publication section of the PEBB and PERS Pay websites. Here's a look at the enrollment form. You can look off to the right there. We have the sex assigned at birth here, male or female. And they got gender identity right there, right below it. So also on the PEBB website, you got the PEBB Program's My Account. Employees can make certain changes through online account. You can also have mobile access to My Account also. One thing we want to let people know is that if they make any changes online, they want to make sure they go all the way to the end in order to receive a confirmation of changes. Again, you can either save a screenshot or print a copy of confirmation. Again, we make sure people go all the way to the end to get a confirmation of the changes they made. They can also use My Account to to view their coverages for medical, dental, basic life, and AD&D coverage. Remember, supplemental coverages and AD&D coverage for supplemental is available through MetLife's My Benefits portal. They can also view basic and supplemental long-term disability insurance through My Account. They can subscribe to email notifications from PEBB. I have myself. So instead of getting a hard copy of the newsletter, I get an email notification when it's ready for me to view online. They can also print off the statement of insurance. Remember, the statement of insurance will only display current information only. Any changes that were made during open enrollment will not be displayed until after the first of the year. So again, if I want to print up statement of insurance after I made changes to say verify they went through, unfortunately, they will not be on that statement of insurance after they're effective. They also can attest to the premium surcharge for tobacco. Again, once any family member age 13 and older is enrolled in medical, again, this is available all year long. Also, during open enrollment, you can do the spousal surcharge. Again, it's only available for the month of November and December. For those who need to attest, they're going to get something before open enrollment. They're going to get communication during open enrollment, and they're going to get communications after enrollment. Okay, again, it's only available November 1st to 31st for the spousal surcharge. What can employees not do during, what can employees not do to My Account? Again, added dependents not currently enrolled in medical, dental. They want to make an address change. They can't use My Account to do that. You want to make sure those addresses are submitted to the employer. Also, we want people not to do if they get a divorce or dissolution of partnership. They want to use My Account to remove those spouses or domestic partners. And the reason why is that co-pack will not be sent if that dependent is removed online. So again, please encourage employees not to use the online account to remove, during open enrollment, to remove domestic partners or spouses, because the co-pack will not be sent to the dependent if it's removed online. Also, they can't make any changes to life or LTD or change HSA contribution amounts through My Account. Here's a look at the PEBB, ERB website. You click on Public Employees, and you see on the top right, My Account. Please encourage employees to go out there, create an account out there, so that way they can view their information all year long. Once they create an account, they log in. You see off to the right there, they can print off a statement of insurance. And if employers who have access to Pay One, not only can they print out statement of insurance for all their employees, now again, we're encouraging you, employees, to go out there and do this for themselves, whether they can't or don't want to. You do have the ability to do that if you have access to Pay One. You can print off a statement of insurance, or maybe you can email it to employees if you choose to do that. They can also print off, you can also view or print off the report for people who have to attest to the spousal surcharge. You're going to see there, subscriber SOI lookup. You look off the right, the report's on the right-hand side there. Now, for employers who do not have access to Pay One and you want that report, we can actually get that for you. So again, send a message to the FUZE and request that report for you if you don't have access to Pay One. And the report usually towards the end of October it's available, just right before open enrollment. So what if somebody made a change online during open enrollment? How would you ever be notified? So again, online changes are submitted to Pay One daily. And how do we share that information with you? So we have this report that we're going to create in mid-December. We'll get it to you, let you know who made changes during open enrollment in the month of November. All right, a couple of medical plan changes for 2021. For Kaiser Permanente, Northwest, and Washington, this is probably standard for all the plans though. You're going to covered one hearing instrument per year every 5 years at no cost. If the person is enrolled in the high deductible plan, the deductible must be met first before they can take advantage of that benefit. And providers may not balance bill you for the service. Again, one hearing instrument per year every 5 years at no cost. For the Uniform Medical Plan, they're going to add a new plan, UMP Select. This new plan will have the same network of providers as UMP Classic and the CDHP plan. For more information about that, please go out to the website. The information is already out there. Have your employees, have you review that information, and maybe it might be an option for you for 2021. Just like Kaiser, be that same covered one hearing instrument per year every 5 years at no cost. If you enroll in that high deductible plan, the deductible must be met first. And providers may not balance bill you for this service. The last one is also a change here. I want to make sure people understand this one too. There'll be a different vision providers there. It's going to be going through the Vision Service Plan, VSP. And it's going to be VSP Choice Network of Providers. Again, for more information about that, please go to the website and read up on that. Again, vision coverage through Vision Service Plan, and they're going to use those network providers for the coverage. UMP Plus Plan, Puget Sound High Value Network. They're going to add the following counties to the service area. They've got Chelan County and Douglas County. They're also going to add 2 provider groups to its network, Confluence Health and also Everett Clinic. Yeah, it's just for the Puget Sound High Value Network Plan through UMP Plus. All right, we got the high deductible plan, consumer directed health plan with health savings account. The annual contribution amount from the employer remains exactly the same. For subscriber only, it's $700.08 per year or $58.34 per month. For subscribers enrolled with 1 or more dependents, it'd be that $1,400.04 per year and $116.67 per month. Again, it remains the same for 2021. IRS maximum contribution have changed for 2020 just a little bit. For 2020, it was $3,550. For 2021, for subscriber, $3,600. So it's going up $50. For subscriber enrolled with 1 or more dependents, it was $7,100 for 2020. It's increasing to $7,200 for 2021. And as past years, if you're age 55 and older, they contribute additional $1,000 per year to the health savings account. Just a little reminder at the bottom of the screen, the employer, the employee contribution, and wellness incentive, if it's earned, may not exceed the IRS maximum. So the employees might need to take track of that. If they earn the wellness incentive, they have to account for those funds so they don't exceed the IRS maximum. Employees want to change their contribution amount, they can do done at any time during the year. We have a form available for them. And employee authorization, payroll deduction to health savings account form is available for employees to complete. All right, SmartHealth. The $125 SmartHealth incentive remains for 2021. We got deadlines of November 30th. And for subscribers with effective date January through September of 2021. For those subscribers have effective date of October through December, the deadline is December 31st, 2021. So again, the $125 SmartHealth incentive remains for 2021. The gift card is coming back. The $25 Amazon gift card will remain for 2021. If an employee goes out there and completes the well-being assessment between January 1st and December 31st of 2021, they will receive that Amazon gift card for $25. An email will be sent to the employees. In order to claim the gift card, they must click on a link. If the employee does not want the gift card, please tell them not to click on a link. If they click on a link, they will receive the gift card. Also, too, that gift card is considered taxable income. The employers are going to receive like a list every single month for employees who've earned the gift card. Employers are required to report the $25 on a W-2. Again, the gift card is coming back for 2021. Premiums. For our employer groups, they're located on the PERS Pay website under the rate page. You'll see here, PERS Pay website, click on rates. Depending on what type of employer you are, here's what it looks like on the right-hand side. Now this right here, the employer group rate surcharge, is already included in the rate. So this is not on top of the rates. It's already included. So these are not changing for 2021. You see for a single subscriber is $12. Subscriber and spouse/partner is 24. Subscriber and children is 21. And for a full family is 33. Again, these rates are included in the rates there that you see on the PEBB website. They're not on top of it. If you have any questions about that, please give us an email through the FUZE. The rates for counties, municipalities, other political subdivisions, tribal governments are included there at great surcharge. Again, K-12 school districts and ESDs do not pay the employer rate surcharge. All right, dental, life, AD&D, and long-term disability. I wanted to point out to you, for your employees, remember, dental, there's no additional cost for employees to enroll their dependents and spouses in dental. They can't have dual coverage, they're already enrolled in PEBB, but if they're non-PEBB, okay, they can enroll there in dental for no additional cost. The dental plans will remain the same for 2021. The reason I'm pointing out is because during open enrollment, if people did not remember to add their dependents or spouses to dental, now's the time to do it. Again, no additional cost to add your dependents to dental. Again, they don't have to enroll in medical, they can enroll in dental only. They have the same dental plans available for 2021, the Uniform Dental Plan, Delta Care, and Willamette Dental. Yeah, no changes to benefits for 2021. A friendly reminder here, Delta Dental administers 2 plans, the Uniform Dental Plan, group number 3000, that's our PPO plan, preferred provider plan, and also Delta Care, group number 3100, that's our managed care plan. Now, a lot of people think Delta Care, Delta Dental, they sound kind of the same, and they sign up for Delta Care thinking it's Delta Dental. You want to make sure if you see that on one of the forms that you kind of point it out to people and verify with the plan, not the dentist, verify with the plan that dentist they want to go to participates in the plan. Okay, so again, call the plan directly. Please don't have them say, hey, ask the dentist to verify. No, please call the dental plan to verify if your dentist participates in the plan. For more information about the plans, you want to visit contact the plan section of the PEBB website. Long-term disability. And this is only for employers who filed long-term disability claims. That's going to employers that key in to pay one. The ones that don't key in to pay one, this information is still there. But again, we're going to be actually filing the claims for you. But if you key in to pay one, you're responsible for filing your own long-term disability claims. Again, this is a new telephone access for filing claims coming January 1st, 2021. Not right now, but 2021. For more information, you want to contact Standard at the Intake Service Center, 800-368-2860. Again, it's going to be available Monday through Friday, 5 a.m. to 5 p.m. Pacific time. Again, employer statement for filing claims requested via email. So very, very, very important. Make sure that you keep your contact information up to date. Also, too, if you want to add a new or secondary contact, please send information through FUZE to the Outreach and Training Unit. This kind of facts about filing long-term disability claim, available on the PEBB and PEBB website. Hey, if you ever have a situation where you got to file a claim and you don't know how to do it, just get a hold of me through FUZE or something. I'll walk you through the whole steps. There's a fax out there in the PEBB or PEBB website if you have questions about long-term disability claim. Here's something new. For supplemental life insurance, be a one-time enrollment windows, again, only through the month of November, not before, not after. PEBB eligible employees can enroll or increase the supplemental life insurance coverage for those months. Again, it'll be an AOI that has 5 questions only. If you say yes to any of those questions, you have to go through the complete process to get the coverage. Again, 5 questions only. If you answer yes to any of those, you have to go through the complete process. For more information about that, you want employees to contact MetLife, 866-548-7139. You want to make sure employees enroll through MetLife's My Benefits portal or complete the Enroll Smart Enrollment form, which will be available on the PERS Pay website. How to apply, here's a link to the My Benefits portal. Here's a login page for MetLife. Again, if they can't access the portal for some reason, there will be a form available, Enroll Smart Enrollment form, on the Forms of Publications page on the PERS Pay website. All right, for life, AD&D and LTD, no changes to the rates for 2021. But when will employee experience a rate change? For supplemental life, if they have changed the age bracket, like me this year, or they have an increase or decrease of coverage allowance selected or elected. For supplemental AD&D, if they have increase or decrease of the amounts coverage elected. And for supplemental long-term disability insurance, if they have a wage change, remember, anytime an employee has a change in wages and they're enrolled in supplemental LTD, you have to either report it to us if we key for you, or you have to go into Pay 1 and update the rate changes. And also too, if they increase or decrease the benefit waiting period. So again, for supplemental long-term disability, for our employer groups, if you have a change in monthly rates for the year, then you have to report those monthly changes, record that information in the Pay 1, so that way we get the correct rate for those employees for that benefit. So for enrolling and making changes to life, AD&D, and long-term disability anytime of the year, you can do that. For supplemental life and AD&D, to enroll, increase, or decrease amounts, you want to either complete the MetLife enrollment change form or visit MetLife's My Benefits portal online. For supplemental long-term disability, to enroll, increase, or decrease the coverage allowance elected, complete the enrollment change form, and if necessary, evidence of insurability form for long-term disability. So again, at the very bottom there, it talks about changes outside of the 31-day eligibility window. They may require evidence of insurability. All right, this section here is just for those who key in to Pay 1. We sent a Gov delivery out there. We kind of talked a little bit earlier about the gender field there. And that's going to be available in Pay 1 here. This Gov delivery is sent out on April 1st. You look on the A01 screen, the personal data screen, and the A43 screen and dependent data screens. You can see the gender field will be named to birth sex. And the gender ID field will be added there for you. So birth sex field, again, mandatory, will be allowed male or female. And the gender field will be optional if they choose to put something there. The gender field will be available for manual entry on October 23rd, 2020.
So thank you, Larry. You did a great job there in the first half. So I get the super fun section. So let's get started with rule changes. Yeah, exciting? Okay, all right. So this is Jamie with Outreach and Training in case there's anybody who came in late. I'm going to cover the second half of the presentation, and then we'll finish it up with a review of the PEBB Open Enrollment webpage so that you can, of course, go out, check out that that website, and it'll be a great resource for your employees during this time as well. All right, so let's get started. These are 2021 rule changes unless otherwise specified. So they're effective January 1, and I'll try to pull anything out that is either current or was made effective earlier this year rather than January 1. All right, so the first one here, currently the way that it works with FMLA is if we have an employee who's on approved FMLA and they fail to pay the employee portion of their premiums for a period of days, I believe it's about 60 days, then currently we can terminate their benefits. Well, come January 1 of 2021, this language has been removed from PEBB Policy 19-1A and the WAC 182-12-138. So that language is no longer going to be there, which means that benefits can no longer be terminated for non-payment of the employee contribution while the employee is on approved FMLA. So if you run into situations like this, you're unsure of how to process it, come January 1st, definitely send a FUZE message out and our outreach and training team can help you out with it. All right, so this one has to do with FMLA and PFML. So we're talking about Washington Paid Family Medical Leave, which was effective back January 1 of 2020. So previously, WAC 12-131 listed both FMLA and Washington PFML in the same subsection, which was a little bit misleading in how the two work together in protecting benefits and that sort of thing. So what they've done for January 1 of 2021 is they've broken them apart. So now FMLA has its own section, subsection 1, and PFML is addressed in subsection 2. And as a reminder, it's the Employment Security Department that determines eligibility for that Washington Paid Family Medical Leave benefit. And this next slide is just a reminder. So this one is a current rule. It's not something that we're waiting to be effective, but I just want to refresh you on it since we are mentioning PFML and FMLA. So for an employee who's on approved PFML, in order for them to maintain eligibility for their benefits the same way that you would maintain while on FMLA, that approved FMLA and PFML have to have at least 1 day of concurrent use. And something that we've recently found is that FMLA has to start first, with Washington Paid Family Medical Leave having at least 1 day overlapping that FMLA in order for the protection of FMLA to extend to PFML. If the employee is only approved for Washington Paid Family Medical Leave, not FMLA, then in order to maintain eligibility for benefits, they have to maintain that pay status of 8 hours or more. And keep in mind that we're talking about general rules here. We're not talking about those special criteria during the state of emergency. This is just general rules here. All right, dependent verification. So last year, January 1st, the rule for how many months previous a verification document could be dated. So those supporting documents that go with the marriage certificate or a certification for a registered domestic partnership, that sort of thing, they had to be dated within 2 months. So starting January 1 of 2021, those supporting documents that have to be supplied with a marriage certificate or that certificate for a registered domestic partnership can be dated within the past 6 months. And when I'm talking about those supporting documents, I'm talking about like a bank statement, mortgage, that kind of thing, showing both the employee and spouse's names with the common address or common information. And just as a refresher, employees can supply 2 separate documents with each of their individual names showing the same address as well. And again, starting January 1st, they can be dated 6 months prior. So eligibility for partnerships of a legal union. So what we're talking about here is not Washington state registered domestic partnerships. We're talking about partnerships who are certified in another state or another jurisdiction. So know that the PEBB program is going to only allow enrollment for those partners for up to 1 year upon initial enrollment. So if they are determined to be eligible for benefits and they're enrolled as a domestic partnership, they can only remain enrolled up to 1 year. After that 1 year, if the subscriber employee has not supplied documentation showing that they and their partner have entered into a legal marriage or a Washington state registered domestic partnership, then the PEBB program is going to terminate that partner's benefits. They'll no longer be eligible at that point. Next one is recertification for dependent children with a disability. So know that the recertification process is going to require renewed proof of disability and dependence. And so employees are going to receive notification of this. About 90 days out, they receive a letter from the PEBB program saying, hey, your recertification date is coming up. And they provide a list of everything that they need from that subscriber to recertify, and they tell them when it is all due, and they have a direct relationship back and forth with the PEBB program in that way. So if you have any questions on this, you can definitely send us a FUZE message, but your employees will be notified in that letter that they receive from the PEBB program. And the information for this has been updated in PEBB Policy 36-1 and WAC 12-260. So this one is just an update of language. So language already existed in WAC 182.12-262 that stated that if a special open enrollment is due to the enrollment of an extended dependent or a dependent with a disability, that the change in that plan coverage is going to be effective the first of the month following the later of the event date or the eligibility certification. So again, whichever one of those dates is later. That already existed in WAC. What they did was they added that language specifically where it says the later of the event date or eligibility certification. We've got it highlighted in purple here. They've added that to the special open enrollment matrix. So there's no change. It's just that you're going to see this extra language on that matrix. All right, so timely notification. So this has to do with employer obligations per PEBB policy and the contracts with employer groups that you have to notify your newly eligible employees. You have to notify them if they're eligible, if they're ineligible, and if they have a change in that eligibility status. So those are the requirements. And if an employee does not receive timely notification, the change here is that they must have no less than 10 calendar days after the date of notification to elect benefits. And I say timely notification, but what does that mean? Well, we're going to go over a couple of, one or two scenarios here just to give you an idea of what exactly we're talking about. But know that as I go through this extra 10 days that an employee could potentially get to elect their benefits, it's not going to affect their date of eligibility or their coverage effective date. Okay, so currently we hire on a new employee, they have a 31-day window. So here's what happens if we notify them late of their eligibility for benefits. All right, in this example, we've got an employee whose first day of work or date of eligibility is January 4th. Well, of 2021, that happens to also be the first working day of the month, so that's going to be their effective date. But based on that first day of work or date of eligibility, they have a 31-day window, so 31 days after that date, to supply required forms and any dependent verification if they're going to enroll a dependent. So they have until February 4th to supply all those required documents. Now, let's say that things get busy or documentation, paperwork gets buried under our desk, or we just thought we sent it in and we forgot, that kind of stuff happens. So we end up finding that we have this employee and maybe we find their worksheet of notification on our desk late and we give it to them on February 1st. We say, hey, employee, oops, you're eligible for benefits, but we do that on day 28. Well, they only have 31 days to make their elections, right? So they've only got 3 days left to supply all the required forms, make their election, get that verification together. Well, according to the new rule, what would happen if they were notified on day 28 is that they're going to get 10 days additional after day 28 to elect their benefits. So in this case, because they were notified late and they did not have 10 days remaining in their 31-day window, they now have until February 11th to elect their benefits. And the last time we covered this, we had a question and it was, okay, well, what if we notify them on day 15 of their 31-day window? Well, they have at least 10 days remaining, so this isn't going to apply in that scenario. It's only going to apply where you have an employee that you notified who did not have 10 days left of their 31-day window. And just as a reminder, if an employee is notified of their eligibility outside of the 31-day window that they should have had, then we go through the error correction process. So you would send a FUZE, and then our gal in outreach and training named Tracy would help you through that process. Okay, so we're going to move on to determining eligibility and emergency hours. So if you take a look at the worksheets on the PERS Pay website, they currently say that if you're determining eligibility, you have to exclude emergency work hours unless they've been approved by the PEBB program. Well, the change is going to be made to WAC 12-114, again, effective January 1. And it states that any hours worked in direct response to a governor-declared emergency are not excludable. So those hours have to be included in determining eligibility. You don't have to get approval from the PEBB program for those emergency hours. If you're not sure what I'm talking about, go out to our worksheets on the PERS Pay website. Take a look at the A1 worksheet. It talks about emergency hours in there. This update will be placed on the worksheet though, so that hasn't been made yet. So as soon as it's updated, you'll be able to see that reflecting on those worksheets if you're currently using them. Okay, so special open enrollment clarification. So last year we had this same slide. I know we have quite a few new groups this year who are on here who might not have been present for that one, but we had the same slide, and what it said was that a special open enrollment event had to be something other than an employee gaining initial eligibility, so a new hire. Remember, they only get a 31-day window. They don't get a 60-day window. It's not a special open enrollment event. Newly eligible employees, they get 31 days. So the update now is that an employee gaining initial eligibility or regaining eligibility does not qualify as a special open enrollment event. So neither of those scenarios get 60 days to elect benefits. They get a 31-day window. And what they've done is they've clarified this language in the special open enrollment matrix as well as WAC 08-198. So this one has to do with a specific special open enrollment event. It has to do with Medicaid and CHIP. So employees are not able to waive PEBB medical if they themselves or their dependent enrolls in or loses eligibility for coverage under Medicaid or the state Children's Health Insurance Program, also known as CHIP. They can make other changes, as are noted in the SOE matrix, but they can't waive their medical for this event. And you'll see that reflecting in the special open enrollment matrix as well as WAC 12-128. So this next slide isn't really a huge change. They've just added the mention of the National Medical Support Notice onto WAC 182-12-262. So there's a subsection with an A, B, C, D that talks about when you can make certain changes. And so one of them is open enrollment, and then it goes into special enrollment. Right below that, it now has National Medical Support Notice with the direct link to the WAC that covers the National Medical Support Notice. So no change really, just that it's the mention of it's been added to another WAC. Okay, so this slide has to do with PEBB Continuation Coverage, unpaid leave. So when we have employees who are still employees, but they're no longer eligible for the employer contribution, and they elect to continue benefits on self-pay, if they also elect to continue life or accidental death and dismemberment insurance, then they have to also continue both basic life and basic accidental death and dismemberment. They can't continue only basic life or only basic AD&D. And that's because there's a basic premium associated with these coverages, and it includes both of these. It includes life and AD&D. It's not split up into the two. And you can see that language has been added to WAC 12-142 and 12-133. So we've got a few more rule changes for you here, but we've broken them out separately because they pertain specifically to eligible employees who are leaving the SEB program or the School Employees Benefits Board program, and they're coming to the PEBB program. So they're coming to us as an employer. And if you're not familiar with the SEB program, many of you I'm sure are by now, but that is the program that the Healthcare Authority is now administering effective January 1 of 2020 for all of the K through 12 school districts and certain employees of charter schools, educational service districts, and so on. All right, so let's take a look. So when we have an employee who's leaving the SEB program, the School Employees Program, and they're coming over to us as the employer for the PEBB program, if they have dependents who were previously verified under the SEB program and they're eligible with us, they are not required to supply dependent verification. So how are you even going to know that this may apply? So there's a couple of ways. If you already know they're coming from a school district or a SEB organization, then you can ask the employee, did you have dependents enrolled with you already? Had they already been verified? Or if the employee comes to you and they say, hey, my dependents were enrolled under SEB, do I have to supply this documentation again? So what'll happen is you won't give them an answer because you'll instead send a FUZE message to Outreach and Training. Our Outreach and Training customer service team is going to take a look in the SEB system and determine whether or not the data in there, in that system, is going to suffice for dependent verification in the PEBB program. So they will respond and let you know whether or not that employee needs to supply dependent verification or if they're good to go. If there's any changes in this process, we'll definitely communicate that with you. But for now, just send a FUZE message and we'll walk you through it. Likewise, for subscribers leaving the SEB program, coming over to PEBB, if they have a disabled dependent child who's currently certified and enrolled in SEB health plan coverage, then they don't have to supply the PEBB certification of a child with a disability form, meaning they don't have to recertify just to come over to the PEBB program at that time. They do still have to complete the PEBB declaration of tax status form that they would submit to you, the employer. Something else to note, though, is this doesn't mean that they don't ever have to recertify. They do have to recertify eventually. That date will be based on whatever their recertification date would have been with the SEB program. And the healthcare authority, the PEBB program, sends out a letter 90 days out, lets them know that their recertification is coming up and everything that they need to do in order to recertify. The same goes for extended dependent children as well. For employees leaving SEB, coming over to PEBB, if they have an extended dependent who's currently certified and enrolled in SEB health plan coverage, they don't have to supply the PEBB extended dependent certification form and valid court order to add that dependent, of course, as long as they meet this other criteria. They do, however, have to supply the PEBB declaration of tax status form as well. And their recertification date will also be based on when their SEB health plan coverage recertification date would have been. And again, they will receive a notification from us when that time is coming. Language has been added into PEBB policy 37-1 for the extended dependent children and 36-1 for the disabled dependent children. So that's it for the rule changes for 2021 for you, but we do have a worksheet revision that was sent out back in August that I'd like to cover with you all just because we've had a lot of questions on it, how it works, and it's very different from the way that we were previously processing transfers, which is what the A5 worksheet has to do with. So we're just going to cover that in the next few slides. So back in August on the 28th, the Gov Delivery message was sent out and it said it is an update to understanding transfer employees. And it provided some examples, which are pretty helpful for understanding how this works. And those examples are also included in that A5 worksheet. I personally found that it's easier to understand how it works by reading the examples and not necessarily the rule that it's included on there as well. So if you're taking a look at that, definitely read through those examples. But we're going to take a look at some examples of our own to try and help you through it. So the revision is attempting to clarify when an employee is considered a transfer. And in order to understand that, we have to know what a break in PEBB coverage is. So for those of you employer groups who have a benefit waiting period, you can disregard what I'm about to talk about because if you have a 30, 60-day benefit waiting period for your employees, they're not going to be considered a transfer when they come to your organization regardless. But for those of you who are basing your eligibility and coverage effective dates off of PEBB rule, you don't have other criteria in your contract, this will apply to you. So understanding a break in PEBB coverage. A break in PEBB coverage is 1 month or more in which the employee does not receive the employer contribution toward PEBB benefits. Everybody good? No, I'm just kidding. All right, let's take a look at a couple of examples and see what exactly does this mean? How exactly does this work? Okay, so I've already given you the answer here. We've got example 1. This employee is not a transfer. So I just ruined the pop quiz, but let's get going. So we have an employee, their last day of work with a PEBB organization was November 13th, which means their benefits are going to end the last day of November, which is November 30th. That's the way things currently work. There's no change there. That's normal. But let's say this employee comes to work at the new PEBB organization on December 16th. That's their first day of work. And I want to note here that that first day of work is after the first working day of the month. That's important. So because they started on December 16th, after the first working day of the month, their benefits are not going to be effective until January 1st, meaning they're going to have a break in PEBB coverage for the month of December. This means that January 1 is their new coverage effective date, and they're going to be treated as a new hire and given new PEBB insurance elections. So they get to choose their benefits all over again, and they should be provided with the appropriate A-Series worksheet. Now, there might be a question popping up in the questions feature on here. Well, what about the break in coverage? Well, know that employees can elect self-pay for a month if they're going to have a break in that coverage. So they don't necessarily have to lose benefits. They would just have to determine whether or not they'd like to self-pay for that month if they're not considered a transfer. All right, so let's take a look at a second example for when an employee is considered a transfer. So we've got the same scenario, an employee leaving one PEBB employer November 13th. Of course, benefits are ending the last day of that month, and they're coming to us, let's pretend we're the gaining agency now, on December 1st. That's their first working day or date of eligibility with our organization. Well, because that's on or before the first working day of the month, their benefits are going to begin December 1st, which means they do not have a break in PEBB coverage, which means they are considered a transfer and they do not receive new PEBB insurance coverage elections. So in order to be a transfer, if they're leaving one PEBB organization and coming to yours, they have to start with you on or before the first working day of the month in order to be a transfer employee and not have a break in coverage. So one way that can help you work through that is the first working day of the month effective date worksheet. I just want to point out a couple of things that you can use as a tool to help you in determining whether or not an employee is a transfer. So this is available in the quick reference guide section of the PERS Pay website. I'm just looking at the image off to the right-hand side. I'm going to circle this November section here. So if we have an employee who starts with us, they left one PEBB organization, they came over to us. If their first day of work with us is on November 1st or 2nd, no later than the first working day of the month, then they're considered a transfer. But if their first working day is November 3rd or later, with their benefits starting first of the next month, they're not considered a transfer. If you have questions or scenarios, things like that you'd like to run through, please send a FUZE message and we can help you work through this if it's confusing at all. Okay, so quick reattestation reminders. For the spouse or state registered domestic partner coverage premium surcharge, the reattestation, employees who are required to reattest are going to receive up to 3 written mailed notifications. So we're going to send out letters. I believe the first round is going out on October 26th. So we just received a notification of that today, actually. So the first one is going to be October 26th, and it's going to say, hey, you are required to reattest to the spousal surcharge. Here's how you can do it. Here's when the deadline is. It'll tell them, I believe, that they have until November 30th, so the annual open enrollment period to do this. And that if they don't, they're going to incur the surcharge for January 1 of 2021 for every month of that year. If they don't reattest during open enrollment, however, they will receive another letter at the beginning of December saying, hey, you didn't do that during open enrollment. You now have an extension until December 31st. So technically, they have from November 1 to December 31 to reattest. If they don't reattest at all, then in January, they'll receive a third letter that says, hey, you didn't do this, you failed to reattest, and so you've incurred that surcharge for every month of the 2021 plan year. And the only way that they can change that is if they experience a special open enrollment event or during next year's annual open enrollment. So I did mention that if they do not attest, they'll incur the surcharge, and they technically have from November 1st through December 31st. I just got ahead of myself a little bit. To reattest, that sheet, the letter that they receive, will tell them they can do so via PEBB My Account, or they can supply the paper attestation change form. And again, that attestation is going to remain in effect unless the employee experiences a special open enrollment event or the next annual open enrollment period, or if their spouse or state registered domestic partner's coverage through their employer, if that coverage changes, then they can make a change at that time. So for employees who are required to reattest to that surcharge, there's going to be a default that flips in Pay 1. So for those of you that key, on the A43 screen where you enter that attestation for the spouse, it's going to change to a D if they're required to reattest to that attestation. Stumbling a little. If they don't attest, the default will remain, and of course they'll incur that surcharge. So for those of you who do have Pay 1 access, you can log into your own PEBB My accounts, as Larry stated earlier, and you can click on the button that says Subscriber SOI Lookup, where you can also look up their statement of insurance. But there's a little green button off to the right-hand side that says Attestations Report. You can click on that and run the report for your organization, and it'll have that D in there for every person who has a spouse enrolled who needs to reattest. So if you wanted to look through that, send them a notification, you're more than welcome to do so. But know that the PEBB program is also notifying them. If you don't have access to Pay 1, you can send a FUZE message and request that attestations report via FUZE. We'll send it over to you, and you'll have that information that way. Okay, so on to annual open enrollment reminders. So dependent verification is due when everything else is due. So for annual open enrollment, it's no later than November 30th. And I know Larry has heard me say this a couple of times, but I am really super excited that November 30th lands on a Monday this year. Last year, it was on like a Saturday, Sunday, something like that, which was really inconvenient. But this year, it's November 30th. All forms and dependent verification are due at that time. And of course, if we have newly eligible employees, they have their 31-day window. Special open enrollments generally is a 60-day window. And of course, if you're able to, if you have employees who are supplying their enrollment forms and trying to enroll dependents with no dependent verification or incomplete or inaccurate dependent verification, definitely follow back up with them and let them know that you still need those required documents. So just a reminder for the CDHP or high deductible plans with a health savings account. If an employee is currently enrolled in that high deductible plan with the health savings account and they're changing to a traditional plan for 2021, then they need to stop any automatic payroll deductions that are going into their health savings account and stop any direct contributions that they're making to health equity as well. That's not something that's going to automatically stop just because they changed their health plan. Also know that employees are not eligible for that health savings account if they or their spouse also enrolls in a medical FSA for 2021 unless that medical FSA can be made limited purpose. So as employer groups, if you have a medical FSA, it's something other than the PEBB program, so you would know whether or not you can make it limited purpose. But it's very important that they not be enrolled in a traditional HSA with a traditional medical FSA at the same time. For employees who are currently 65 or older or who will be turning 65 in 2021, we strongly discourage them from enrolling in a high deductible health plan with a health savings account without seeking professional tax advice. So they are welcome to contact Health Equity if they have questions, but they should also be reaching out to their tax advisor. This is not something that we can advise on. But know that the reason why we discourage them from it is because Medicare can be enrolled up to six months retroactively, which can put a kink in things for them if they're also enrolled in the HSA at that time. So when it comes to enrolling newborn or adopted children during the month of December, we suggest that employers key those dependents as quickly as possible in the system. And this is because if the employee is also making other changes, whenever we key those changes, it can cause confusion with the carrier, and then we have to sort of figure those out. So we want to get any of those issues fixed and ironed out as soon as possible prior to the first of the new year. Also know that effective date for that newborn or adopted child is going to be that date of birth, date of adoption, or date that subscriber or spouse assumed financial responsibility for the child. If you're unable to key that date, please do not enter just any date and then ask us to fix it. It's very difficult to do that. Just hold off, send us a FUZE, and we'll help you through it. So know that during open enrollment, our FUZE messaging system, it gets pretty busy. So normally we have a 2 or 3 day turnaround time. During open enrollment, it's definitely delayed. So know that we are working through those in order received. You will get an answer. It just may take a little bit longer. And know that we do have the 1-800 number you can call as well if you have an emergency. But please, we ask for your patience. We are working through those as quickly as possible. I know Larry and myself are helping out with them as well. But a couple of tidbits just to let you know in case you don't already know. One is if you send in a FUZE message and you don't receive an answer in a number of days, and then you send in another one on top of that same message to check on the status, that's going to put you at the end of the queue. So your original message will go all the way to the back of the line. So if you can avoid sending any status update requests in the same FUZE message, please do so. It'll only make it take longer for you to get your response. Also, if you are sending in a FUZE message, please avoid sending multiples or duplicates of that same request, because we can end up with 2 different people trying to process the same FUZE, maybe even at different times, and that just it takes up work time and it's unnecessary as well. So hopefully that'll help with everybody getting their FUZEs answered as well. So definitely don't want to send that extra message if it puts you to the back of the queue. So here's that phone number I was talking about a few minutes ago for outreach and training. It's the 1-800-700-1555. It does get pretty busy during this time as well, but that one should be used for emergency purposes. We do also have the PERS Pay website, so there's tons of stuff on there for you, guidance, resources, manuals if you're having trouble keying things into Pay 1s. We always suggest if you're having trouble, go out there and take a look first and see if you can work your way through with the guidance that's provided out there. And of course, you have FUZE. And know that employees should not be reaching out to us directly. We don't have enough people to handle all, was it 600,000 employees? There's quite a few of them. So employees should come to you with their questions. And then, of course, you come to us and we process everything for you, get you your answers, and then you relay the info back to them. So again, please don't share our contact information, our FUZE messaging system, phone numbers, things like that with employees. Also, our PEBB customer service line, the 1-800-200-1004, is specific to retirees and continuation coverage members or those looking to enroll in those types of coverages. Unfortunately, that customer service line doesn't have the capability to answer employee-related questions, so they will be redirected back to you. For employees and, of course, yourselves, there are multiple resources other than the PERS Pay website and FUZE. You also have the PEBB website, which has a section for employees, a section for retirees, and continuation coverage on there, as well as all of the forms, all of the enrollment guides. Of course, forms for 2021, as Larry stated earlier, are not available until November 1st. But it does also have the individual plan websites and all of the contact information for each health carrier. We've got health equity listed here. And then employees can contact MetLife directly, as well as the SmartHealth program if they have questions on SmartHealth. And know that employees should be contacting their health plans directly for questions with their benefits, their claims, if they have issues or would like to request a new ID card, or if they're wanting to check and make sure a provider contracts with the plan, or making sure prescriptions are covered, or if they have specific prescription cost questions, they definitely want to reach out to the health plan for that. We don't expect you all to be able to answer those questions, and they're not questions that we can answer either, so definitely have to go direct to the plan for that. What employees should contact you with are questions about their eligibility or changes in eligibility, or if they have questions about enrollment, making changes, that kind of thing. If they have questions on their premium surcharges, need assistance finding forms, if they would like to add or remove a dependent and have questions about that process or require dependent verification, if they have questions on life or LTD, or for payroll deduction information. So here's that web page I was talking about a few minutes ago. Hopefully you're all familiar with this, but as you can see, we've got some arrows pointing to everything. We've got a PEBB section specific for public employees. Off to the very right-hand side, we've got the retirees section. It's got the forms and everything that they need to know about our PEBB retiree coverage. And then down below, we've got continuation coverage, and there's a SEB and a PEBB section. So we definitely want to make sure they're going to the proper section there for information. So I'm actually going to take you out to the open enrollment webpage now, and we're going to review some information on that OE page. Hopefully familiarize yourselves a little bit so that you can share that with your employees as well. All right, so I'm going to clear out of here. Don't mind all of my windows. I've always got a million tabs up. So I'm going to click on my nifty toolbar here. I've got all of my websites saved. So I'm going to hca.wa.gov. And the section mine takes me to automatically is the employee and retiree benefits section, which houses the public employees, retirees, and continuation coverage pages. So as you can see at the top of the screen and the photo with the little family here, we've got an open enrollment link for SEB and PEBB. So we definitely want to be careful to make sure employees are clicking on the correct one. So if you're providing them with a link, double check that link that you're giving them. I'm going to take you to the public employees page first, but they could click on open enrollment right there if they wanted to. Now, when you're in the public employees section, it only gives you information for PEBB, which is really nice. So you can see at the top right-hand corner, we've got My Account. And then another image of a family here. We've got open enrollment for PEBB and the virtual benefits fair for PEBB. So I'm going to open up each of those in a separate tab as well. And know that the health plan information for the new plans and any changes has already been posted out here as well. So you can always check that out. All right, so open enrollment page first. So it automatically puts me on the employees section. So, and it does contain information for retirees and things like that too, but it's specific about who the information is for as you're scrolling down. So the first one here is, where do I find changes that affect me? What changes can I make? And how do I make changes? So they can click on those drop downs and it'll give them more information. And the forms will be out here eventually as well on November 1st when they're available. Talks about premiums and benefit information. And of course, for employer groups, you determine premiums for your employees. So this is not going to apply, but the life and AD&D and long-term disability premiums will apply. They can use the medical plan comparisons if they are thinking about changing plans. Find out which plans are available to them based on where they reside. View the summaries of benefits and coverage to look at those certificates of coverage. They can find providers, look at the information for premium surcharges. They can also review the benefits newsletter that was sent out. This link here just lets them know that there are no in-person benefits fairs for the benefits fair link. And then it mentions the virtual benefits fair, which we're going to take a look at in a minute, and it provides the web link direct to it. Just below, we have the Facebook Live event that already took place on the 14th. But they can follow that link, go out to Facebook, and I actually was on it earlier today just testing it out, and you can definitely watch those videos without logging in. The only part that's kind of annoying in my opinion is that it'll constantly be prompting you to log in, but you don't actually have to do so. You can still navigate the Facebook page, you can still click on the videos and watch those recordings for that live event. And then we have the webinar section, which is the last one that I really want to pull up for you. So under webinars, I'm going to click on check out the schedules. This is a little small. I apologize for that. I'm going to zoom it in a bit more. Maybe that's too much. Okay, so at the top, we have our menu, medical plans, dental plans, and additional benefits. So we have all of our medical plan information there. It'll talk about the carriers and the webinars that they're hosting. So let's see, I'm just going to click on UMP. So how do I register, dates and times, and then it's got registration links there as well. The only dental plan hosting a webinar this year is Willamette. And then under additional benefits, we've got the long-term disability insurance webinar as well. And of course, the medical FSA here does not apply to employer groups. So that's the open enrollment webpage. Now I'm going to go over to the virtual benefits fair, which I opened up earlier. So it starts off, it's got Dave right here with a little welcome message. And then if they scroll down, it'll ask them, who are you? And we can click on I'm an employee, or we can click on for employees under the PEBB section on the left-hand side on the toolbar. And it gives you 3 sections, and that's it on this page: medical, dental, and additional benefits. So I'm going to click on medical just to show you an example. But it gives us 3 booths. So we can go to Kaiser Northwest, Kaiser Washington, or Uniform Medical Plan. So you click on it to visit the booth, you can watch a video about it, and then there's more information on the web page about their changes and the webinars here. All right, so that's it for the review of the web pages. Larry and I are going to take a couple of quick seconds to see if there's any questions that we need to address before we go. But know that this webinar is being recorded as we speak, and we're going to post it on the notices and updates section of the PERS Pay website. You can expect it there by the end of this week or early next week. There's a multi-step process, so we just have to get through that. And then you won't receive a notification that it's been posted, but you can go out to the notices and updates section and you can keep an eye on that. It should be there by early to mid next week at the very latest. So of course, if you have any specific questions that we weren't able to answer today, please do send those via FUZE. If there's anything that we couldn't answer during this webinar that you sent in, we'll definitely send you an email or send you a FUZE message with a response later on. But Larry, is there anything that we need to address before we go?
Hey, Jamie, I answer all the ones that we had.
Okay, perfect. Thank you, Larry. All right, so again, if we didn't catch your question yet, or if there's anything that pops up, we will address that. But we do want to thank you all so much for coming and being a part of today's webinar. We appreciate it.